I am a sexual health nurse, and to be honest, I spend the vast majority of my time in what I'd like to sort of coin action mode. So consulting with clients and treating chlamydia, delivering sexuality education, attending stakeholder and practice meetings, condom demos, can't go away without them, chasing results, encouraging people to pee in a jar, counselling clients in crisis, all while at the same time what I'm trying to do is nail this perception that I have all the time in the world for the person sitting across from me to tell me every intimate detail of their sex lives. So then I can go ahead and make an adequate assessment. I'm really quite relieved to see that there is a couple of people nodding, so I'm not the only person that lives in this organised chaos, I suppose you could say. So when I was asked to come here and speak today about how we do community engagement, and in particular how we engage our hard-to-reach and high-risk young people, it did give me an opportunity to really reflect about, I suppose, how we've gone about doing that at Clinic 35 since inception and over the last 5 years, and how that's evolved. During this time of reflection, I admittedly was a little bit conflicted as to how to pitch this presentation, and kind of decided that while I will sort of really, for about 30 seconds, touch on some theoretical underpinnings, I'm going to stay out of the academia world, because I think this morning's it's kind of a little bit fresher, and it's a little bit, we're talking about things that are probably a little bit more tangible. So what I'm going to do is pretty much tell you what we do to engage people and how we went about doing that. And I promise you we won't do any condom races throughout the presentation, but that's how I would want to engage you all. So I suppose, very briefly, a bit of an overview. I want to talk really briefly about this review called the Upper Hume Region Sexual Health Review that took place back in 2009. And it was a consultation that really framed the establishment of Clinic 35 and our initial plan for community engagement. I think it's important for me to provide you guys with this information, because what it will do is sort of set the context for some of our engagement strategies that we use. I will just give out a little disclaimer and say that we're really lucky. Clinic 35 was established from scratch, so it really provided us with a rare and exciting opportunity to be able to create a service that was based on sort of best practice principles, building our own foundations and our own culture. So we were very lucky in this way. I will then discuss, and my leg's going, did anyone else see that? I will then discuss our engagement strategies, which we've sort of coined a proactive engagement strategy. I'll talk a little bit about the levels of engagement that we go about engaging, so those levels being a community level, a stakeholder level, and also an individual level for engagement. I won't talk for that long, so hopefully we will have some time for questions at the end for these guys if we wanted to. So I usually start my presentations by sort of, with young people where I'm from, by saying that the rumours are true. And what I mean by that is I usually say things like, you know, we do have really high rates of chlamydia in our young people, and we do have really high rates of teen pregnancy. So in the Wodonga region, those aged 24 years and younger do comprise of quite a large percentage of our population. Adolescents between 10 to 17 years old represent about 11% of our total population as well. And as we know, young people do have high rates of chlamydia, so we do have because we do have a lot of young people, we are going to have a lot of chlamydia. And one of the other stats that I think is really interesting is that in 2008, the rate of babies born to teenage women in the Wodonga region was about 25.9 per thousand. Now, to give a little bit of context to that, that rate is actually double that of the Victorian rate, and it's also higher than rates in Shepparton and also in Frankston. So this is where we are. So the Hume region is actually the orange section on the little map of Victoria there, and the city of Wodonga is up the top there. So in 2009, Gateway Health commissioned the Upper Hume Region Sexual Health Review. This sexual health review was initiated out of the response of the closure of the Wodonga Sexual Health Clinic, which operated out of sort of a larger tertiary centre in Wodonga. And it was a long-standing sexual health clinic that ran from sort of 1993 to 2009. It was one of 6 state-funded clinical services in Victoria. The review identified local sexual health needs and explored the options for clinical service delivery or provision in order to sort of guide the redevelopment of a model that was local and responsive to needs. It involved the establishment of a reference committee and a project team, consultation with key stakeholders, in particular those that were already working with the priority populations as outlined in our national strategies. It looked at a brief scan of relevant rural sexual health models and also the current sort of policy context. There was a lot of gathering of information and talking to people, and also looked at sort of the development of some recommendations with consideration to our funding allocation. The review proposed a nurse-led model, and if you listened to me talk yesterday, I talked quite a bit about nurse-led models, and we adopted that in our practice. And we also incorporated this notion of accessible and inclusive and targeted sexual health service provision with a strong emphasis on health promotion and prevention. So the review also recommended the need for a comprehensive access and inclusion strategy. So what on earth does that mean? So we actually adopted this, which thus I feel laid the foundations for our overarching community engagement approach. The access and inclusion strategy looked to address a range of factors such as where on earth the clinic was going to be located, so the geographical location of the service, how to address specific needs of our population groups, and also the sensitive nature of STIs and bloodborne viruses in a rural context. Clinic 35, based on these sort of best practice principles and with the underpinning values of access and inclusion sort of at the forefront, the clinic was established and we opened our doors in October of 2010, which scares me that it's that long ago, to be honest. So what does striving for accessibility kind of mean? Clinic 35 was set up as an integrated sexual health service within a big, larger community health setting, which at inception, that community health setting, we already had other services like drug and alcohol services, pharmacotherapy program. We had young parent support programs there, counselling and support, and a needle and syringe program. So what that kind of meant for us is that we already had direct access to a lot of the priority populations that we needed to engage. This service has now grown. We do now have other services that include a medical practice, CASA, so the Centre Against Violence, also Headspace and a refugee clinic. We are located in the main street of Wodonga, which is helpful. We're opposite a bus stop, again, great for access. We're a free service. We provide appointments 5 days a week, not on the weekends yet, we're getting there. We can accommodate walk-ins and have the capacity to provide services to people who don't have a Medicare card and who are under 16 years old. So in terms of access, there wasn't much more that we could sort of put in place. To be inclusive, we worked really hard to make sure that our clinic and our waiting rooms were acceptable to our target populations. We trained our reception staff to address sensitive questioning around sexual health and around young people. We undertook training in cultural awareness, building on trust and respect. And we also achieved our Rainbow Tick accreditation, consisting of 6 standards that the services work towards to demonstrate LGBTI inclusive practice and service delivery. So I guess the reason I'm kind of telling you this is because we knew that if we got our foundations right from the beginning, that Clinic 35 would build a culture and create a space that would be deemed acceptable by our priority populations, and in particular young people. So our next step was, while we'd set up this great service, was now how do we go about engaging people to walk through the door? The strategy we adopted is what, again, I'd like to coin a proactive engagement strategy. So the approach is based on engagement at an individual, community, and then at a stakeholder level. What it does is it promotes outreach strategies, active community participation, fosters community and stakeholder partnerships to establish and maintain effective referral pathways. So we've heard a lot, actually, over the last couple of days about establishing important strategic partnerships and integrating services, which makes me feel a little bit relieved because it means that maybe we're doing something right here, which is great. I also just wanted to clarify that while our service uses many approaches and we're involved in many projects to engage young people, today I'm just going to really touch on and discuss a couple of the more successful and probably, to be honest, some of the more rewarding projects that we've been involved in. So from a stakeholder level, our engagement at the stakeholder level really sort of highlights the importance and the long-term benefits of strategic partnerships. While Clinic 35 already had direct access to some of those populations that we talked about, we channelled a great deal of time and effort into seeking our strategic partnerships with other organisations. So as a result of this work, and I guess a lot of emphasis on being placed on nurturing and sustaining these partnerships, we've successfully raised the sexual health awareness among stakeholders in the Wodonga region, I kind of think we have anyway, which is contributing to what I would argue is what we'll call a supportive sexual health service system, which Alana has been speaking about over the last couple of days. So as we know, the 15 to 29-year-old age group have the highest rates of chlamydia nationally, making people under the age of 30 a priority population as per our national strategies. So for this reason, we decided it was probably obvious to go somewhere that had direct access to young people. So what we decided to do to start with was to engage with our education settings. For this reason, we started by making contact with our stakeholders across the education department. So that meant people who worked with the Department of Early Childhood and Development, our local high schools, both public, private and Catholic, alternative school settings, which included places like the Flexible Learning Centre in Albury-Wodonga, Too Cool for School, which is another initiative for people that aren't engaged in formal school, virtual schooling, and also our High Water Theatre. We tried to engage people from the community colleges, the TAFE, and also the local universities. By doing this, we were able to negotiate time with staff to discuss local trends and also provide some information about what our role was in the community and what they felt that our role was as well. As a result, we were able to build relationships with local education providers, deliver information about our service to the students, which was obviously very important. Enrolled, we offered secondary consultations to school nurses and to student welfare coordinators and assisted facilitate in some sexuality education for both teachers and young people attending the schools. While you can probably imagine that this level of engagement was tiring and most certainly was absolutely time-consuming, and it was extremely time-consuming, Clinic 35 now has what I'd like to sort of brag and say some great long-standing relationships with local education sector, and is involved in quite a lot of school setting projects such as Help for You and Skills for Life. The value of continuing this level of engagement over the last 5 years with the education sector is that it obviously provides us with direct access to young people through the education system. So anecdotally, what I can tell you is that after participating in the delivery of sexuality education or providing information about Clinic 35 in a school setting, what Clinic 35 sees is a spike in the attendance of people from that setting, so from the intervention. The involvement of staff from Clinic 35 also helps to break down some of those barriers of fear and uncertainty around accessing sexual health services. And it does help that we're pretty charismatic and lovely people as well. So what about young people that aren't engaged in the education system? So to engage these young people who are arguably more vulnerable and not currently participating in formal education, what we did was we sought to create partnerships with pre-existing local organisations and services where we knew that vulnerable young people were already engaged. So we actively sought to create relationships with welfare services, with housing, with child protection, and with the maternity unit at the Albury-Wodonga Hospital. This strategy promotes a coordinated and an integrated service response through collaboration with other services already engaged with priority populations. So a great example of how we collaborated was that we strengthened and formalised a strategic partnership with a local youth service that supports very high risk and vulnerable young people. The aim was, I guess, to look at increasing sexual health awareness for both staff and for their clients. This has probably been one of our more successful strategic relationships. What we did was we worked with staff to include a basic sexual health assessment on their initial intake with their new clients to determine whether or not their client was sexually active, whether they were using contraception and whether they'd ever been screened for STIs before. So as we know that sexual health professional support and training is essential for all sectors of health and the community sectors, improvement in prevention and testing and management rely on the various sectors of the workforce feeling confident and skilled in discussing sexual health. Once staff felt comfortable in discussing sexual health with their clients, a referral pathway was put in place for clients to access Clinic 35 for education, for testing and for management. We have also adopted this same strategy and applied it to existing program areas within Gateway Health, so including our Young Parents program, pharmacotherapy program and our drug and alcohol programs. This method of engagement has improved sustainable, as while practitioners come and go, the assessments stay, and they stay in place. So what it does is it helps put sexual health on the agenda. So what about young people who aren't engaged in the areas that we've sought partnerships? I guess I giggled to myself yesterday when I was listening to the panel discussion and we were saying if it's not online, it's not on. Because what we sort of did to start with our engagement process 5 years ago was we took a bit of an old school approach and we looked at marketing engaging through the use of stickers. And there's nothing wrong with using stickers, I might just add, because for those of you that lived in the Albury-Wodonga region about 5 years ago, you would know that you couldn't use a public toilet or a toilet in any of the local pubs without closing the door and seeing a Clinic 35 sticker stuck on the back. And look, we also had a lot of fun giving them out and getting people to put them up around the community. I guess with our little key sexual health messages, we also, though, did decide to use sort of more up-to-date methods of marketing engagement through the use of Facebook, which most people do. But interestingly, while I think Facebook, really it remains an important avenue for clients to search for where Clinic 35 is and search for services, it hasn't been taken up as a method of engaging with our clientele. It's more about advertising and it's more about how to find us. We do find as well that a lot of the stakeholders that we've engaged with, they're also the people that are more inclined to engage with our Facebook page. I'm thinking about using Tinder though after Teddy's talk yesterday. Might have to get you to help me set up a profile. Yeah. Be afraid to be heard. So we also are involved in quite a lot of projects that engage young people. We actively participate in many community projects at a grassroots level. These projects may not specifically be addressing sexual health, however, it provides an excellent opportunity for us to be a presence in the community. While we have collaborated on many projects, I'm just going to highlight 2 of those projects. Those being those that we've used to help engage our young Aboriginal and our young culturally, linguistically diverse populations, being Midnight Basketball and also the Smart and Deadly project. So for those of you that don't know what Midnight Basketball is, it's a harm prevention charity that runs a national social inclusion program aimed at sort of at-risk youth and helps them to embrace positive opportunities. So in our local area, the program is run once a term on a Friday night from 7:30 until midnight. And staff include volunteers from local youth organisations, Rotary and security. And I'm sure you're wondering why on earth they would need security, but let me tell you that Midnight Basketball is intense. There is a compulsory life skills workshop that runs each week that the young people have to attend in order to be able to play in the tournament. So in Albury, the tournament attracts more than 120 young at-risk people between the ages of 12 and 18 years old, and predominantly from an Aboriginal or a cold background. Clinic 35 runs the sexual health workshop and also provides a volunteer at each session of the tournament. Over the years, the workshops have they've evolved and they've changed to be responsive to sort of the young people's needs. And last year, I ran our first session at Midnight Basketball on pornography, and it just so happened that it was coincidentally the same Friday night that the Canberra Capitals were playing in Albury, and Lauren Jackson attended the workshop. And that was pretty intimidating, I might just add. So after her initial shock at the activity that we were running, which was called Porn versus Reality, I think that she learnt quite a lot, actually. So back on the Victorian side of the border, Clinic 35 has also conducted workshops at the Wodonga Midnight Basketball, which is sort of a newer tournament. Wodonga, for those that don't know, has a really large migrant and refugee resettlement area, with an estimated 15% of the population being born overseas. And interestingly, our most second spoken language is Bhutanese. The tournament in Wodonga is aimed at migrant and refugee young people, some of whom have never heard of a condom before the Clinic 35 workshop. So you may have heard, or you may recall, a fair few of us at the last Sexuality conference talking a great deal about this best practice amazing project, which was called Smart and Deadly. So the Smart and Deadly project was actually a project that Search led, that was a project in collaboration with Aboriginal elders, Aboriginal young people, members of the Albury-Wodonga community and local organisations. So the objectives of this program was sort of to design and implement and evaluate a local sexual health promotion program targeting young Aboriginal people and their families, using the principles of health promotion, of Aboriginal health promotion practice. The project response was overwhelming, and I think for us at Clinic 35, because that project was run over quite a long time, so sort of a 12 to 18 month period, we were able to develop really strong connections with the local Aboriginal community and also the local Aboriginal organisations, thus allowing these connections to sort of develop over time respectfully and also organically. And what they've done is they've developed into strategic partnerships. Clinic 35 was an active participant in each step of this project and assisted in the development of some really amazing resources, which I still see pop up on social media and sexual health and youth websites from now and then. And I do encourage anyone that hasn't seen these resources to jump online and have a look, because they're hilarious. So on an individual level, I think I've mentioned in the past that Clinic 35 has some pretty awesome staff that work for us. Our engagement is really based on providing a safe and confidential and inclusive environment for our young people to access our sexual health services. So the sexual health journey starts as a young person walks through our front door and they're greeted by a bowl of condoms, and then our front of house, followed by what I would say is a comprehensive consultation with one of our sexual health nurses or one of our GPs who have sexual health training and are also sensitive to the needs of the complex nature of working with young people around sexual and reproductive health. Word of mouth has been, while not directly engaging young people, is something that we've relied quite a lot on, and has been a very powerful marketing engagement strategy for us in being able to engage more young people. So we are really nice to everyone that walks through the door. So I'm getting the wrap up. I guess it's sort of important for me to touch on sustainability and how on earth we are going to, in time, sustain on this level of engagement. And as you can imagine, it's time consuming, totally worthwhile though. And I guess by actively engaging our local community through this strategy, the service has obviously become really, really well known, which has placed an enormous demand on our clinical service provision. Sadly, while our service has grown exponentially, our funding hasn't, and it's something that we need to we obviously need to deal with. So just to be very clear, Clinic 35 is actually really quite a small service. So we only it sort of includes the funding equivalent of one full-time nurse. We do have 2 nurses, and also some about 3 or 4 hours of a GP or a medical director each week. As a result, we've had to be really selective in the projects that we invest in. And so we really do go out of our way to invest really in partnerships and projects that are targeting youth, and in particular high-risk youth. It's because we understand, I guess, the importance of doing this that we're committed to proactively engaging this target population, and that we've been able to invite our high-risk and our hard-to-reach young people to walk through the front door. I guess, just to finish, I would like to have a chat to you about 3 things I'd like you to take away from today. 3 words really, or 3 concepts. So one of them is proactive, and I think really what we have learnt is that for us it's been really, really important to make sure that we've been proactive in how we've gone about engaging people. So I think sometimes it's really easy for us as clinicians and for people to get bogged down in our day-to-day tasks and action mode, as I coined it. However, it's really important that we prioritise engagement, and that we really do take opportunities and plan for engagement. And also innovation. Sometimes it really pays to think outside of the box in how we go about engaging people. So while we might not necessarily be involved in projects that specifically are targeted for sexual health, what we do is we're involved in projects that are specifically targeted to young people. And finally, access and inclusion. I guess by laying the foundations that we did of accessibility and inclusivity, what this did was it grounded these concepts into best practice for us, and it gave us the opportunity to really create a culture that invited our at-risk people to walk through the door. So thank you.